So the ECG that you're seeing here is of a person who is apparently asymptomatic. There are no cardinal symptoms of any cardiovascular disease. And if observed casually, this ECG also seems okay. But wait, look at the T waves in the V2 and V3 leads. They seem out of ordinary. They are not what a physiological T wave should look like. So this, my friends, is a ticking time bomb in an ECG and represents a syndrome known as the Wellens syndrome. And the presentation that we are getting here indicates that a patient is going to have a massive infarct in the near future. So, in our clinical discussions, we came across the concept that Wellens syndrome is caused by critical LAD occlusion, but that is not the real reason. As doctors, we need to go till the root of the disease and always cite reasons exactly as they are. So let's understand the central idea behind a Wellens pattern. So this is not simply due to a narrowed LAD. The first step occurs is a critical LAD plaque which is unstable. This is followed by transient occlusion where the patient will experience symptoms. After this, there is spontaneous reperfusion wherein the ST elevation which was transient will resolve on its own and the pain will improve. And this is followed by the Wellens pattern where T wave changes appear. So after this spontaneous reperfusion, different parts of the ventricle will recover at different times, producing a repolarization gradient. This vector points away from the anterior vector leads, leading to T wave inversion. So these vectors are represented by the V2 and V3 leads primarily because they directly face the anteroseptal and the anterior left ventricular portion which is supplied by the left anterior descending artery. So the Wellens syndrome is of two types, type A and type B. In type A, there is biphasic T wave pattern which indicates early T wave repolarization through a relatively normal myocardium, indicating a positive wave followed by a terminal negative wave which indicates delayed repolarization through an ischemic myocardium. In contrast, the type B indicates deep, symmetric and inverted T waves indicating a more established repolarization gradient, leading to such presentation. Now if there is LAD reocclusion, the T wave presentations will start disappearing and they'll appear upright and prominent. This is known as pseudo-normalization and is not a sign of improvement but worsening. So this is the concept of Wellens syndrome. Thank you. Please like and subscribe.